You're watching The Source on CNN Philippines. Our source today, Health Spokesperson, Undersecretary Maria Rosario Vergeire. Yusek Vergeire, welcome back to The Source. Also, maraming salamat po sa inyong oras.
Magandang umaga po, ma'am, and good morning to all of you.
Yusek, daily cases are rising. If we were to average it, maybe about 500 in the past couple of days. In fact, yesterday, I think we recorded over 600 cases. But I read that you had stressed that we should be careful and not call this a surge. Why, and how will you describe the increases that have been recorded so far?
Actually, ma'am, when I said that let us not call this a surge, because we try to avoid using this term from the previous increases in cases, because this has caused a lot of confusion among the public. Right now, what we are seeing is that the number of cases are continuously increasing, especially here in the National Capital Region. And we can see that this is really the start of the peak in the number of cases. No, we have started like this in the previous increase in cases, just like last January or last September when there was Delta and Omicron, respectively. Right now, the whole country have recorded around 2,458 new cases for last week. And that is about 60 to 70% increase in the number of cases. In NCR, we can see that it has doubled already their average number of cases from the previous week. And we have seen that there is the 70% increase in the number of cases. Their average daily attack rate is now at 1.02, where in fact, for the longest time, we had less than one average daily attack rate. And positivity rate also has increased.
When you say we are seeing the start of the, is it right, the start of the peak of the cases?
Yes, ma'am. I think we are seeing that the number of cases are continuously increasing already compared to the previous months wherein we had really this plateau in the number of cases. Now we are seeing there is continuous increase. And we are, again, guiding our public and making them aware that this might be the start that the cases will continuously rise in the next couple of weeks.
What would be the reasons for the increase, Yusek?
Well, there are a number of reasons. First and foremost, the entry of the subvariants of Omicron. These subvariants had been reported to be more transmissible, and they also evade immunity, the immunity that the vaccines have given us. Second, we know that our mobility patterns have really increased. We are about parang pre-pandemic na, yung ating mobility. Everybody goes to work, everybody goes to the different places. And then the third would be the waning immunity of the population, because we know that there is very slow uptake of our boosters.
Right. I was going to talk about that, especially with the waning immunity, because the surge that we saw the last time was in January because of the Omicron. And then we were good for a couple of months, and then lumabas nga tong BA.4, BA.5, BA.2.12, all these subvariants, ano po. And by this time, we're looking at June, parang most of us, if I'm not mistaken, umabot na po tayo dun sa 6-month, I don't know if you can call that threshold, but yung pinaka-protected ka while being vaccinated. So the problem is also that not a lot of people are really doing booster shots. I think we're numbering at about 14 million only out of 70 million that have been fully vaccinated.
Yes, ma'am. So right now, we have an eligible of 55 million individuals to receive their boosters. And you're right, we only have about 14.7 million individuals who have received their boosters. So we are looking at around 41 million individuals who have not received their boosters. And we know that the immunity is waning. So we need to have this demand from our countrymen.
Yeah, and it's interesting because in the last week or so, LGUs have reported an increase in those taking their booster shots because of news that the COVID-19 cases were increasing.
Yes, ma'am, that's right. So I think people had been more or less complacent for these past months because of the plateauing of cases, because there are less cases. So they are not really thinking that this COVID-19 is still here and it's of risk for them. So right now, when the cases started increasing, people are now going to our vaccination sites, receiving their boosters. But I hope that a lot of people know there would be more demand for this, and they will not wait until cases are so high already that they receive their boosters by that time.
Right. But aside from the number of cases, you have said this time and time again, another factor that needs to be considered here really is the hospital utilization. We're going to talk about that, but we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our source today, Health Undersecretary Maria Rosario Vergeire. Yusek, let's just look at the numbers again and for everyone else's benefit. So, yung nakapag-booster na po, 14 million out of about 70 million who have had their full vaccination. So that's very low. That's the first booster shot. What is the update on the second booster shot? For those who might be interested, sino lang hubang pinapayagan ngayon for the second booster?
Yes, ma'am. No? So for the second booster, according to the Emergency Use Authority of FDA, we are only now allowing or giving second booster shots to senior citizens, those with immunocompromised conditions, and our healthcare workers.
Right.
Currently, we have about 640,000 plus who have already received their second booster shots.
Do you think it's about time, or should government already consider giving a second booster to the general public?
We always base our decisions on evidence. And currently, evidence for second boosters among the general population is still very sparse. There is really no direct evidence right now that it would provide more benefit to our general population when we give our second boosters to them. Currently, our experts are saying that our first boosters still works for us, no, the general population. The very reason why we are giving the second boosters to immunocompromised senior citizens and our healthcare workers, because they are vulnerable.
Right.
They cannot produce these antibodies compared to a healthy individual.
But isn't the first booster, please correct me if I'm wrong, Yusek, is basically good for more or less the next 6 months?
Actually, ma'am, the evidence as to the length of immunity that the vaccine provides for us is still not really complete, no? We do not base it on the length of time, but we base it on the ability of the body to produce antibodies and make their immune system robust. That's why we are prioritizing those who are vulnerable right now, not really the length of immunity or the length of time that you are immune from this COVID-19 because of vaccines, but because of your ability to produce your antibodies to protect you from infection.
Yeah, those are absolutely important. Isn't it also the T cells as well that is produced once you are vaccinated? I left, before we went on a break, I was talking about healthcare utilization. Last I saw, this was about 17%. When we talk about cases, and I know you've said this time and time again, hindi lang naman kaso tinitingnan natin. Very important, equally important, is the hospital utilization. So that remains low at 17%. But are these the moderate and severe? And if so, ano po yung percentage ng moderate and severe?
Yes, ma'am. No, so currently our admissions for COVID are still that less than 20% across the population or across the different regions. When we look at the number of severe and critical, it is around 9.7% out of the total admissions for COVID-19 across the country. When we look at the asymptomatic, mild, and moderate, you're numbering around almost 90%. And pag tinignan po natin, yung asymptomatic and mild talaga ang mas madami, no? So nag-a-admit uli ang ating mga ospital itong mga asymptomatic and mild cases. What I can tell you would be, let's qualify what is 9.7% severe and critical in our hospitals. We need to determine if they really went there because they had COVID or they went there for other conditions and incidentally they were tested and they had COVID. That's why they are there. So it's about 50-50%. No? So this 9.7% would be that 50% of this would have really COVID and the other 50% were incidental COVID cases.
They could have had pre-existing medical conditions or comorbidities, and COVID also came into play.
Yes, that's right, ma'am. No, so for the 50%, they have other conditions, and then when they were tested, because it's part of the screening of the hospital, they also tested positive.
Yusek, which areas is the government monitoring right now in terms of just case numbers, increase in number of COVID cases?
Well, right now, ma'am, we are really closely monitoring the National Capital Region. No? So because we are really seeing this continuous increase at medyo mabilis and sharp ang increase ng cases sa National Capital Region. We're also monitoring areas in Region 6, in Region 10, also in Regions 1 and 2, and Region 4A and 4B.
Marami-rami na rin, Yusek, na binabantayan, ha?
Yes, so pero kailangan ma-qualify din natin uli kasi yung ibang areas po kaya talagang binabantayan dahil nakita natin na nag-increase ang kanilang growth rate. Pero pag tinignan natin, from just 2 cases, naging 6 or 10 cases, yung ibang areas.
Yeah.
But as I've said, here in the National Capital Region, the increases are significant already.
Right. And then, this could even be an underestimation because there are people who may have COVID symptoms, maybe did an antigen test. Obviously, that is not part of the records that the government is able to put together. And they stay at home. Marami pong ganun din ang kaso na nangyayari ngayon.
Yes, ma'am. That's part of our assumptions already. Actually, when we do our forecasting, we include that. We receive reports from local governments for this antigen test, and it comprises about 20% of the total number of reports that we have right now. But we still need to validate because we don't know if they have used this antigen appropriately,
Correctly.
no, based on protocols.
Right.
So ngayon po kasama sila sa projections, kasama sila sa pagpaplano rin.
Health Undersecretary Maria Rosario Vergeire, ma'am, thank you so much for your time.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.